Hey, what's up, guys? It's Dr. Wyatt, and thank you for taking the time to look at this video on the common injuries that runners face and injuries I've faced in the past in my running career and how I used to approach it and how I approach it now. So the reality for runners, 60 to 80% of runners will experience an injury every year. It's going to happen to us, guys. We just got to be able to accept it and also try to prepare for strategies to prevent it from taking us out for the whole season, or maybe just a minor setback or indicator saying maybe we're doing too much too soon, or maybe we need to adjust some things on the route. So just because you have the injury doesn't mean that your season is going to waste. It's just how we are going to attack it is the key important thing about running and returning from running injuries. So what we'll learn today in this series is what the injury is. I'll go over some anatomy and warning signs. What is research? I'll pick a research topic on the specific area that we're talking about this week. And then common treatments and why some of them fall short. And then how we take a different approach and look at the pelvis, the ribs, and breathing. And we'll get into that a little bit later. And then an option for an assessment. I included a video to see if you actually can pass this test. And if not, the options is to purchase a plan where I can give you some exercises to focus on those deficits if there are any. All right, so let's get started. So what is runner's knee? Some people call it Patellofemoral syndrome. In other sports, you can hear it called jumper's knee, pain, just knee pain in general. So what happens with this is when you're having pain around the top of the kneecap or the bottom of the kneecap and sometimes on the side, and it's usually with running downhill, squatting, or just sitting for long periods, right? So this affects up to 40% of runners, and some people can actually get it when they're going up steps. So going up steps and coming down steps, or running up a hill and coming down a hill, the muscle is being placed in two different actions. So going down, you are needing to control that lengthening tension, which we call in the weight room eccentric, and then going up is more of a shortening concentric force on the knee. So it just depends, and that's how we'll be able to be specific with this. So the anatomy of the runner's knee. What is the knee joint, right? So the knee joint is the thigh, which is your femur bone above the knee, and then your shin bone, which is below the knee. And then we have the patella, which is a little kneecap, the cap that you feel if you press down, and sometimes it's pretty painful, but that moves in between some grooves that you guys can read as well on the screen. I'm not going to read word for word. You guys have access to this and you can look at this at a later date. But this is just what makes up the knee. So we have cartilage, we have some ligaments, ACL, PCL, MCL, LCL, tendons, patellar tendon, quadricep tendon, the hamstring tendons in the back connect with the back of the knee as well, and the goal load during running. So every stride places up to 3 times your body weight through the knee joint. So this is very, very important because if your hips, core, and ankles aren't absorbing their share of that, the knee becomes the shock absorber in isolation, and we don't want that. We want your knee to have help from its friends below and above. So signs and symptoms that you may get as a runner, and if you've had this issue before, you've probably felt these before. So you can have pain with running, squatting or lunging, discomfort, once again, going downstairs. Some people can get it going upstairs. And then it's just this dual nagging ache, and it just won't quit. If it's sharp shooting, burning, radiating, that's most likely not coming from the knee. You got to look above the structures or below. And if it's going down into the toes, from assessment of how we work, I'm looking at your back. Something is off in the back that's causing that. That's more of that nerve pain. You may get it that's like kind of local. Knee pain is more local. If it starts to spread up and down, you're dealing with more than just the knee. So common issues that we see is icing, stretching, rest to kind of calm that pain, but they don't correct why the pain happened, right? So those address the symptom. I'm a physical therapist, so I dry needle, I do soft tissue work, and it's all great, but that's the symptom that's causing that. So if we only look at the symptom, that's when we get into problems, because the cause of that injury is not necessarily the same place that the symptom that your experience could be. Knee pain, and how we look at it, is coming from the hip all day until proven innocent, right? So the hip is going to be guilty, or I would go deeper and say the pelvis is guilty until proven innocent. The knee is just there, and it's going to absorb the shock, and you don't want it to absorb it by itself, right? So you have people hear about weak glutes, poor core, right? And that's true because the knee loses alignment. So that's the goal that we're trying to figure out, is what is the cause? Because you can take 3 months off, you can take 2 months off. If you never fixed it, when you return and you increase volume or if you increase intensity, that knee pain is definitely going to come back because you never fixed the cause on why it was there in the first place. So a cool study. I'm going to do this with research, and as a physical therapist, I got to make sure that we're looking at research. It don't dictate everything I do, but it also gives me some evidence and guidance as well, right? What's out there. So this was a cool study written by a physiotherapist named Tom Goon, phenomenal guy. He's big with runners, and they talked about a 10% increase in step rate to improve knee pain. So what they basically mean is, we all hear about the cadence, and 160 is too much or too low, and you want to get that ideal 180. 180 is not, it's almost impossible to try to do that every race, right? Or every run. So ideally around 160 or 175 to 185, you can play in that. But how they did it was they used it to by a metronome. So it's just kind of like tapping at around 175 to 180. And they did that for about 10 minutes before a run. And they did show over weeks that it improved function in runners, and the patellofemoral pain was decreased. But once again, it's a lot more than we need to put on just at the knee. And this was one of the results that they got from the baseline, and the pain scale did go away in about 12 weeks. So that's good. It's promising. We definitely know mechanics play a role, but it's more than just mechanics. And this is what this guy, Tom Goon, was saying even at the end. So education and activity modification is going to be key. So how we approach this is, the missing link is the rib cage, the diaphragm, the pelvis, and breathing. And I'm not going to read this word for word, but take your time to look at this, because it is where you start. The pelvis, the rib cage, and breath will dictate how your arms, how your legs will move. And this big core, work on core strength. I'm not talking about planks. That is not addressing what we're talking about in our program. We need to look at the alignment, right? Because everything needs to stack. So the visual cue is, imagine your rib cage, which is where you bring in breath, right? Your lungs sit under your rib cage. It's like a lid, and your pelvis is the bowl, right? So when the lid sits perfectly over the bowl, you can breathe deep into your belly, your sides, and your back. Not just your belly, your sides and your back as well. And your whole system is balanced, right? So if your lid kind of tips, right, and the bowl tilts, and we call it more of an anterior tilt. That's why a lot of runners get pain in their back, and their hamstrings and glutes stop working. That's a problem. And when you get that tip, like we said earlier, now your friends are on board. Your glutes can't work well. Your hamstrings don't work well. And your quads become shortened, and they start to compress at the knee, and the knee now takes all that load. This all started from breathing, rib cage positioning, and pelvis positioning. This is key. So most rehab, once again, stop at muscle and joints. And guys, I do it all the time. I used to do it. I used to dry needle all the time. I used to soft tissue work, ART. I used to do all of these things, which work. It does work. But in isolation, it doesn't work at all. You can get a chiropractor adjustment. You can get a massage. All of those things are addressing the symptom. But if we don't look at the previous slide and how mechanics and everything are working, it's going to bring temporary relief. And when you increase in mileage once again, or intensity, it's going to come back. So that's the goal. We want to make sure we're fixing the alignment and breathing. This is just not a detail. This is the toolbox for you to run faster and more efficiently and more effective to decrease load on our joints. So what's the root problem? It's rarely the knee problem at times, right? It's more than just the knee. It's the hip, it's the pelvis, it's the feet, it's the ankles, it's the core, it's the rib cage, right? You name it. It's more than one isolation joint. And that's what we're trying to get back at with this. And once again, this test that I use with all my runners, I actually use this with anyone I practice with, is very, 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 very challenging if you're true to yourself. So when we look at this, we want to make sure that we have a certain movement level. So 0 to 3 is high risk for compensation, injury, and wasted energy, right? If your pelvis and rib cage are not in a good position, it's wasted energy. So we want to make sure we change that. Level 4 to level 5 is acceptable. This is where you can start to throw in some strength training, right? We don't want to jump to strength training, because strength training won't change alignment. It's going to make you stronger in the pattern that you're presenting in, but it will not change alignment. Some things will help, but if you're not talking to the nervous system through breath work and pelvis alignment, rib cage alignment, strength training is not going to get you out of these injuries, because most runners lift and they still get injured. So we know strength training is not the start that you need to be with, or start off with. We need things before strength training. So why does this matter? So it's not just about the knee or the foot, right? This test reveals how your whole body manages load, gravity, and movement, not just your right knee pain. Your right knee pain could be because of your left hip or your left rib cage being flared and it's not working well. Once again, it's all connected, guys. The whole body is connected. How your arms swing can determine how you use your knees. So when we look at this test, the whole body is involved, and it's very challenging. And I recommend, I want you guys to try this if you get time. So can you pass this, right? So if you want to try the test, what's going to be on next slide, definitely try it. If you're in that 1 to 3, or you're like, I don't know where I'm at, Verrelle, I would definitely hop on a call for you. We're making this pretty affordable, because I want you to have a great running season, even if it's not me coaching, right? You don't have, this is not to get me to coach you. This is simply saying, hey, Verrelle, I did a test. This is the level I think I'm at. I'll have you do the test, and then I'll tell you where you're at. And then we're going to give you exercises prescribed specifically to that level. So therefore, you get the feedback you need. And down the line, if we need to reassess those things, that's something we can hop on another call for as well. So this is the test. Once again, take time to read listen to the video. I go step by step. And once again, be honest with yourself. This test is legit and is challenging. And the results are based off of you being honest. If you can't feel it, it doesn't count. You have to feel the muscles for you to know that they're working with you when you're at mile 20. Breaking down at mile 20 is not just carbohydrate depletion and all of these things we talk about. Your form will break down. Therefore, it requires more energy. Therefore, energy is ATP. Where do ATP come? You have to get glucose. What is glucose? Carbohydrates, carb loading. So I say all of that to say this. It's not just carbohydrates that can break you down. If your body is not in a good position, it will overwork, therefore requiring more carbohydrate usage. Look it up. It's powerful. So like I said before, if you're interested in learning more about your results, right? If this is something that you want to know more about, you're like, Verrelle, I have all these injuries, they're just changing positions. This is a great test. And when we get on the call, it's just $47 to get your results read. We'll go over the test. I'll have you do the test again in front of me. I'll critique it. I'll write down the exercises, prescribe them. You'll get them a link, and that's what you can start off with. This is powerful. If you keep having injuries or setbacks, or you feel like you're overworking, this is probably the missing key, and this is how we address our injuries from the inside out. I look forward to hearing from you. If not, thank you for watching the video, and I hope you learned something in this series focused on the knee pain, patellofemoral syndrome. More to come. Peace.